For years, the healthcare debate has been raging in our country as candidates and officials offer different perspectives on the best way forward. The truth is that despite recent reforms in the ACA, many Americans remain discouraged and disappointed in our healthcare system. I've continually heard from constituents frustrated about the lack of access to quality care and the ever-increasing costs. Many counties are left with only a single insurance provider and premiums that continue to rise. Simply stated, the current system is failing. That's why this week the House Ways and Means Committee, on which I serve, and the Energy and Commerce Committee have begun considering legislation that seeks to expand healthcare choices, improve quality, lower costs, and empower low and middle-income Americans who do not have access to employee or government-sponsored healthcare. It is our goal to empower individuals and families so they can choose the best healthcare plan for themselves. For me, this is simply about providing a better healthcare system for our country, especially for working Americans who struggle to find access to quality care. Unlike the Affordable Care Act, which punishes Americans if they fail to purchase health insurance, our plan will provide advanceable, refundable tax credits to those seeking plans on the individual market on a monthly basis, helping them to pay their healthcare premiums. The tax credit phases out with rising income and will increase as people age, allowing it to focus on helping the people who really need it. Americans will choose the plan that best suits them, not the plan the government dictates. We're keeping the things that work, like guaranteed coverage for pre-existing conditions, allowing young people to remain on their parents' plans until the age of 26, and prohibiting discrimination against women. We've also built in a multi-year transition period in order to avoid sudden disruptions for individuals currently receiving coverage through ACA plans. And we've eliminated taxes that have increased the cost of healthcare in our country and inhibited investment and economic growth. We've restored funding for hospitals that treat the most vulnerable in our communities and created a patient and state stability fund that will be available to states, lowering patient costs and stabilizing state markets. Unlike the ACA, this law was not written by powerful health insurance companies, big hospital chains, or pharmaceutical companies seeking to protect their profits. It was written for the American people by their representatives in a transparent manner to lower costs, give patients and doctors more decision-making power, and establish a true healthcare market where people can make informed choices. The fact that the far left and the far right have come together to viciously attack this proposal is likely a good indicator that it is sound, sensible policy. The consideration of this legislation in our committee this week is only the first step in finding a better healthcare solution for our country. There will be opportunities to amend this bill and make it stronger in the weeks ahead. So I invite you to share your thoughts and views as this BetterCare proposal makes its way through the legislative process, because it is so important that we get this right.